not sure how we feel about that, but we're going to put the questions to the Transportation Commissioner coming up. All right, in health news right now, we are launching a new series. It's called Surviving the System.
And it's all about navigating the healthcare system. It's a challenge that all of us deal with. Dr. Sapna is here with her first report. Not easy.
Not easy. I know, and not the most exciting topic, but it's one that all of us, like you said, have dealt with. This whole series is based on emails that we've received from our viewers, and the #1 complaint that we got was that the cost of health insurance is going up. So here's one family's story and 3 tips to help lower costs. Insurance costs for her and her family keep skyrocketing, and the benefits keep nosediving. She's thinking about getting another job just for the health insurance.
It would be a sad thing to do because I love being home for my kids.
Beth Sudol and her husband Henry have 4 children. They own their own construction company, so they pay for health insurance out of their own pocket.
This year, they had an astronomical jump of $250, a little over $250.
A month.
A month.
Their insurance premium was $1,347 a month, but this year, for the exact same coverage, it jumps to almost $1,600 a month.
What's it going to be in 3 years or 4 years or 5 years? Was it going to be $3,000, $4,000? It's never going to stop.
When you get insurance bills like this, it really adds to the pain. But you have to keep your family insured. We have 4 young children.
You know, they get colds and flus and all this sort of thing.
I sometimes get running noses.
So why is the price going up? We asked Andrew Rubin, Vice President of Clinical Affairs at NYU Medical Center and an expert on navigating the health insurance system.
Technology is expensive, seeing your doctor is expensive, and you got to pay.
He has 3 tips to save you money. First, if you're in good health overall, pick the plan with the lowest monthly cost. But there's a catch.
And the way you do that is you pick a plan with higher copays and higher deductibles.
To pay those higher copays and deductibles, Andrew has tip #2. Set up a health savings account if your employer offers it.
You can use that money that you put in tax-free to pay the first dollars of your health care costs up to that deductible.
And tip #3, give up your freedom of choice.
One of the ways to keep costs down is to have patients stay within network. The more restrictive the plan, the lower the costs are going to be.
That's what the Sudol family will now have to do. They chose a new plan that's cheaper, but it doesn't cover any doctor who's not in network, including Beth's doctor, who she's been seeing for 19 years.
He delivered all 4 of our children, and I don't plan on changing him. I just hope I don't have any real issues.
Otherwise, the best plan for her will be to switch doctors altogether. So this series is going to continue, and next month the topic is what to do when you lose your health insurance. So if your company stopped providing health insurance, or if you lost your job and therefore lost your insurance, please send me an email. Go to myfoxny.com, click on the health tab, and you'll see a button on the right-hand side that says Surviving the System. And if we pick your story, we'll come out to you and interview you, share your story.
Good information, Dr. Sapna. Thank you.
Thank you, guys.
Thank you, Doctor.